Today I would like to share some knowledge regarding knee joint. You know, the knee joint is the second most largest joint in the body, but for the symptoms, for the problems, it comes as of first, other than the back problems. So grossly, the knee joint problems can be divided into two segments. One is degenerative. Degenerative means those problems that comes after a certain age group. You know that we all are getting aged day by day. So the knee joint and its cartilage, that also in some people, the effect of this degeneration is much more comparing with their age. So the cartilage problem, that is generally termed as osteoarthritis, that usually comes after 50 years of age. But in some cases, some patients suffering from knee problems, you can even get to know the things in early 40s too. So the cartilage problem, if you ask me some that how can we prevent that, there is nothing much, only thing weight reduction and active some exercises, all these. But if you do some more exercises, more running, these all are good for the body, but when the knee is concerned, that will make problems with the joint as such. So we don't advise much to do this vigorous joint straining exercise that may again affect the healthiness of the cartilage. So coming to the cartilage problem, this is the cartilage. You can see something, a bluish colored thing. This is the cartilage. So after 50, 60, the cartilage, the water content that gets reduced and the wear and tear, that is the osteoarthritis. Coming to the latest treatments, we can broadly divide the treatment regimen into, one is supportive treatments, that we can, there are some tablets available in the market which contains collagen and glucosamine. All these can supplement, that will nourish and we hopefully get a good result taken. But we need a prolonged treatment with all these vitamins, substituting treatment. The other thing is concerned, you can even, there are some fluid that is available in the market, that is hyaluronate injection. That also we can, this is a viscous fluid that also if we inject into the joint, that will ease, it will act as a lubricant mainly. That also is a mode of treatment. The other treatment for osteoarthritis that includes in the early stages, we can do some arthroscopic keyhole procedures. We just put the scope and deep red and all the inflammatory, the pain causing substance we can have removed, and we can just shave it out any degenerative meniscus. Meniscus means inside the knee joint. There are two washers and the ligaments are also there. We can just evaluate and just see that. So that's it. We can tell it's a conservative mode of surgery, the arthroscopic lavage and wash out, injecting this viscous fluid. All these can aid in that symptomatically the patient will be better. And at the last, that comes when these things are irreversible and almost affected a part of cartilage, then the treatment comes as total knee replacement. Again, everyone will be thinking that it's a major, big, huge surgery, but in fact it's not, because now in the market the available things, with all these available things, instruments and all, the easiness of surgery, we can mobilize the patient, we can make them to walk the next day after surgery. So we cement it. We in the surgery, as generally we just remove that the deranged or the damaged cartilage. All this will comes around 1 centimeter thickness that we remove, and we fix it with metallic implants. We cement and fix. So there is no time for bone ingrowth or something. We can mobilize them in the next day, and by the time 2 to 3 months, the patients will be, usually they will be happy, the range of movements and everything. So these are all a nutshell about the degenerative things. Then coming to sports injuries, that's commonly seen in young active participants, the patients. They comes with some ligament injury, meniscal injury. All these have that with the new latest generation implants and instrumentation, the treatment parts and that rehabilitation period, everything have come to reduction. We make them to drive the car even after 2 weeks of surgery. In the keyhole procedures, it's all about putting an incision up to 1.5 centimeter incision, and with that scope and camera we see everything and we can repair reconstruct all these things. Even we use bioabsorbable implants. That means after a fixed period of time, say 5 to 6 months, the implant itself will get into the bone and there is no need of removal of the implant. There is no metallic allergic reaction. All this can be reduced with all these things. So these all are about a nutshell. That's all for now, and goodbye. Signing off, Dr. Umer Farooq, Nizwa, Badr Al Samaa.
Thank you.